Hello, my name is Dr. Joyce Van Donkersgoed. I'm a feedlot veterinarian in Southern Alberta. Today I would like to talk to you about liver abscesses in feedlot cattle. Liver abscesses can occur throughout the feeding period. They typically develop in 3 to 10 days after an incidence of grain overload or ruminal acidosis. These liver abscesses may resolve in 45 to 80 days, and you may see a liver scar on the capsule surface for those that have resolved. Liver abscesses observed at processing are believed to occur predominantly during the last 60 days on feed. If you look to the picture here on the right, this is an example of Elanco's scoring system for liver abscesses. A normal liver has no abscesses. An A- liver has 1 or 2 small abscesses. An A liver has 1 or 2 medium to large sized abscesses. You can also see on this picture there's a ruminal scar on the surface. And an A+ liver is a severely abscessed liver, may have multiple large abscesses throughout. A+ livers are condemned at slaughter, whereas the A and A- are typically downgraded to a pet food liver. The prevalence of liver abscess is highly variable amongst feedlots and amongst lots within a feedlot. Prevalence appears to be higher in the winter. We're not quite sure why this is, but it could be due to more variable feed intake with weather changes. We also see a higher prevalence in feedlot steers than heifers. If you look at the 2 national beef quality audits that I conducted for the industry in 1995 and 1999, the prevalence of liver abscess is 1% higher in steers than heifers. It is believed this is due to the higher feed intake of steers and typically the longer days on feed for the same incoming weight group. The incidence of liver abscesses is also believed to be higher in Holstein steers, and again that is predominantly related to the longer days on feed for those cattle. There is, however, considerable animal variability in the incidence of liver abscesses as well as the risk of grain overload, and this individual variability is not well understood. Liver abscesses in feedlot cattle are diet-induced. Ruminitis, which is an inflammation of the rumen, can occur from either acute or subacute acidosis. Acute acidosis occurs quickly. These animals have clinical signs very quickly or are suddenly found dead in a pen. Subacute acidosis or subclinical acidosis is where we have caused grain overload in the cattle, but we do not see clinical signs in the animals. If you look at the pictures here on your right, these are pictures of 2 animals that died of acute grain overload. They had severe acid production in their rumens, and this damaged the lining of the rumen. Typically, if you scrape the little papillae off the rumen wall is white in color. You can see that in both these pictures the rumen is extremely red and angry looking. In fact, on the picture on the bottom, the intestines are also red and they typically contain a reddish fluid, and the other stomach, such as the reticulum in the bottom picture, is also extremely red. So severe inflammation from the acid production that happens with grain overload. Because the rumen wall is damaged, it then becomes susceptible to invasion by bacteria that are typically in the rumen. Bacteria we most commonly see with liver abscesses are Fusobacterium necrophorum and Actinomycetes pyogenes. These bacteria then infect the ruminal wall and they can create little abscesses in the ruminal wall. These bacteria can also enter the blood circulation and end up in the liver, where they create an infection and abscesses that we see at slaughter. If these liver abscesses grow and penetrate the large vein that goes to the lungs, both the bacteria and pus can travel to the lungs and either cause an acute or chronic embolic pneumonia. These lungs, if we open them up, they will have multiple abscesses within them. If it's a chronic embolic pneumonia, if it's an acute, typically these animals die of a shocked lung and the lung is heavy and wet. If the abscesses grow into an artery within the lung, the animal then can bleed out. The picture here on your right hand side shows you actually a large liver abscess that has penetrated the large vein, the caudal vena cava that runs to the lung. Animals with liver abscesses typically do not show any clinical signs of disease unless the liver abscess has ruptured and is causing a peritonitis, which is an infection in the belly, or the liver abscess has spread to the lung and is causing a secondary embolic pneumonia. If these animals do not die from the abscesses in the lungs, they may look unthrifty and look like they have pneumonia. If that abscess penetrates the artery in the lung, These animals will start bleeding, just like the Holstein in the bottom picture here, and they may die from blood loss. The picture of the lung there actually shows you dark areas within the lung, which is normally a normal pink color. These dark areas are actually blood within the lung of an animal that died from this syndrome, which we call caudal venal cave thrombosis. So how do we prevent liver abscesses? Typically, feedlot producers will put tylosin in the feed to control liver abscesses. This is the only antimicrobial approved in Canada for the control of liver abscesses. This additive is fed at 11 parts per million throughout the feeding period, and it has no meat withdrawal. There's numerous research studies that I've referenced here that show that tylosin in the feed will significantly reduce the incidence of liver abscesses in feedlot cattle. There is some research that suggests the impact of tylosin may vary depending on what ration we have. This was some research done in the U.S., but in a subsequent study that was done in 2013, it showed that neither inclusion of corn wet distiller grains with solubles or the corn processing method, whether it was dry rolled, high moisture, or steam flaked, influenced the effect of tylosin in reducing liver abscesses. Therefore, based on the results to date, tylosin will reduce liver abscesses. It does not eliminate them, but it can reduce the level up to 50%. What else can we do to reduce the incidence of liver abscesses? Well, there has been some work looking at the potential of vaccination against the bacteria that cause liver abscesses. There's only one vaccine commercially available in Canada at this time. It's called Feedlot. It is sold by Elanco Novartis Animal Health. This vaccine is a kill vaccine that requires multiple doses. It also has a long meat withdrawal period. There is very little efficacy data on the value of this vaccine in feedlot cattle in reducing liver abscess. In one study done in Canada, they found that vaccination did reduce the incidence of liver abscesses in cattle that were on a forage-based growing diet. However, it had no effect on cattle on a grain-based growing diet, which is typically what our feedlot cattle are on. In another study conducted in the U.S., vaccination did not reduce the incidence of liver abscesses. Therefore, it is not common for feedlot veterinarians to recommend vaccination with Feedlot, given the limited efficacy data out there, as well as the cost of the vaccination and long withdrawal period. So what else can we do to reduce liver abscesses? Probably the most important thing we can do is sound nutritional management. We strongly encourage feedlot producers to work with their nutritionist or veterinarian on ways to reduce ruminal acidosis or grain overload, and thus the risk of liver abscesses, which are secondary to grain overload. There are numerous studies that have shown that having sufficient fiber or forage in the ration will reduce the risk of grain overload and also liver abscesses. Fiber stimulates adequate chewing and salivary secretion, which is necessary to balance the acids produced during fermentation when we are feeding grain-based diets. In one study in Canada, it showed that the percent of liver abscesses was higher in cattle that were limit-fed a high-grain diet than those in a higher roughage diet. Addition of hay in another study did reduce the incidence of liver abscesses better than cottonseed hulls, ground corn cobs, or oyster shells. That's a very old study, and these products are not typically fed in Canada. Another study found there were fewer liver abscesses when hay instead of corn silage was used in the initial diet prior to the finishing period. And then in another study in steam flake corn-based diets, which are more typically fed in the U.S., a higher percentage of liver abscesses were observed when corn silage was fed instead of alfalfa hay. Therefore, based on those trials, definitely having some fiber and some forage in your ration will reduce the risk of liver abscesses. But there's always a balancing act between the amount of forage that we put in the rations and our dry matter conversions. And that's why we feed more grains, to improve dry matter conversion. The other risk factor in ruminal acidosis is how we manage our feed bunks. There are some suggestions that rapidly increasing dietary energy and poor or inconsistent feed bunk management, either characterized by irregular feeding in amounts or intervals, may cause acidosis ruminitis, which in theory can lead to more liver abscesses. However, as you review the literature, there's very little data actually tying these variables in feed bunk management to the incidence of liver abscesses. While the data can show that bunk management can significantly affect ruminal pH, these studies have not necessarily followed through to look at the incidence of liver abscesses. Some new research suggests that cattle can actually alter or regulate their feed intake pattern depending on variations in feed bunk management, so there is less of an impact on feed bunk management changes and the risk of ruminal acidosis. But whether, again, this actually relates to changes in the incidence of liver abscesses is not known. Therefore, there is further research required to look at the impact of variations in feed bunk management and the risk of liver abscesses. The risk of liver abscesses may vary depending on how fine we process our grain. In theory, if we process our grain finer, we increase the risk of ruminal acidosis and possibly liver abscesses. In one study in barley-based diets, they found that processing barley to attain a processing index of less than 75% increased the risk of acidosis in low-fiber diets. In another study with finer particle size, there was an increased risk of ruminitis. One study that actually looked at liver abscesses, they found no difference in them whether or not they fed a pelleted or a rolled barley in a barley-based diet. Steam flaking or tempering barley did produce liver abscesses than dry rolled barley. What kind of grain we feed may also increase the risk of ruminitis and thus, in theory, liver abscesses. In grains that have higher rates of starch fermentation, such as wheat, we may have a greater risk of ruminitis and thus liver abscesses than barley compared to corn. In one study, they had a higher incidence of liver abscesses in cattle fed triticale and wheat compared to corn grains. In one study, wheat, whether it was hard or soft, did increase the risk of ruminal acidosis based on ruminal pH compared to barley. In another study, liver abscesses were greater for dry rolled barley than either steam flake corn, and they were also greater for hulless barley than conventional barley. Another study, liver abscesses, however, were not different in cattle when barley silage and barley were replaced with 15% whole oats. In the old days, we used to feed oats to calves when they first came in rather than barley, trying to reduce the risk of grain overload and liver abscesses. However, this study suggests there was no difference. In another study, replacing barley with 30% canola meal had no effect on liver abscesses. In some U.S. research based on U.S. diets, in steam flake corn sorghum rations, there was no difference in liver abscesses with either steam flake corn, dry rolled corn, or high moisture corn. And another study, increasing the dietary wet corn gluten feed in a steam flake corn diet did increase the risk of liver abscesses. Another study, increasing the wet corn gluten feed to that of corn and heifers initially restricted in feed intake, reduced the liver abscesses. And another study, feeding brewers grains and high corn rations reduced liver abscesses. And then in some work looking at sunflower seeds, fishing diets, it had no effect on liver abscesses. There has been a lot of work looking at distillers grains and replacing our dry grains with distillers grains. In theory, we should have less ruminal acidosis or liver abscesses feeding distillers grains because they do not contain starch. In one study, they actually saw increased liver abscesses when barley silage was replaced with wheat dry distiller grain solubles. However, multiple studies after that found that replacing barley grain with either wheat or corn dry distiller grains with solubles, various rates did not influence the rate of liver abscesses. In some work looking at feeding triticale dry distiller grain solubles instead of barley silage and barley grain in a barley-based diet did increase the rate of liver abscesses. Then in a U.S. study in steam flake corn finishing diets, corn or sorghum wet distilled grain with solubles did not increase the incidence of liver abscesses. In another U.S. study, there were no differences in liver abscesses in cattle fed dry distillers grains with solubles in either steam flake corn or dry rolled corn diets. So based on the Canadian data and the kind of rations we feed, it does not appear that replacing barley grain with either wheat or corn dry distillers grains at various rates will influence the rate of liver abscess formation. There has been work looking at the risk of ruminitis or grain overload when we do things like reduce the amount of water availability or the quality of our water. We know that poor feed mixing or inaccurate feed scales can increase the risk of ruminitis. There's some work suggesting limiting bunk space can increase the risk of ruminitis because of competition amongst the cattle. We definitely do know that feeding the wrong ration to cattle, for example, feeding a finishing ration to new calves coming in, will create or increase the risk of acute grain overload. However, there's no research to show that any of these factors that impact the risk of ruminal acidosis actually increase the risk of liver abscesses. Experimentally, we do know that rumen acidosis can be induced by withholding feed 12 to 24 hours and then feeding 100% of the normal day's feed, showing how increased meal size can precipitate acidosis. But again, most of these studies have not followed the cattle through to see if the increased risk of ruminitis with these variables also impacted the incidence and severity of liver abscesses. So further research is required. We also don't know what the impact is on the incidence and severity of liver abscesses when we fail to diagnose animals with ruminal acidosis. If you look at the clinical signs of acute grain overload or acidosis, these include things like reduced feed intake, the cattle won't chew as often, they will be depressed, their rumen or stomach is not going to be moving very well, so they may have secondary gas bloat. If they have severe acidosis, they may be uncoordinated, weak. You may actually find them down in the pen on their brisket with their head turned into their flank. These animals will become dehydrated because they get a fluid accumulation or water accumulation in their rumen. And as a result, they also get a large pot belly. Over a few hours, they can develop a watery, sour-smelling, foamy diarrhea. They tend to get a secondary metabolic acidosis, which can result in rapid respirations. These cattle with overloads will be stiff and they will develop founder. If we cause severe damage and kill the good bacteria in the stomach that produce thiamine, we can get a secondary polio, which is a nervous disease from thiamine deficiency. And obviously, if the acute grain overload is severe, these animals may just be found dead in the pen with 4 legs up. But if you look at some of these clinical signs, such as depression, rapid respirations, these animals can actually look like a pneumonia. And pen riders may misdiagnose a grain overload and treat them for pneumonia. And obviously the antibiotics we use to treat for pneumonia will not work to treat grain overload. What are the economic losses from liver abscesses? Well, they are severe. If you look at beef quality audits done in Canada and the U.S., the largest cause of condemnation at slaughter is due to liver abscesses. According to John Lyons from Cargill, today a 14-pound liver, which is approximately the average weight of a liver, is worth $10 Canadian. These severely abscessed or A-plus livers will be condemned. Those with small abscesses or healed scars may be downgraded to a pet food liver, but they're sold at a major discount. As well, these abscessed livers may have adhesions to other viscera in the guts, and as a result of that, the entire offal can be condemned. Or if during processing one of these abscesses ruptures and contaminates the rest of the viscera, again the entire viscera will be condemned, which comes at a significant economic loss. There have been numerous studies done that have showed that severe liver abscesses, those which we call an A+, have been associated in feedlot cattle with reduced dry matter intake, reduced average daily gain, reduced dry matter conversion, reduced hot carcass weight and dressing percent, reduced sub-Q fat, and increased carcass trim. As a result, liver abscesses are something that both feedlot producers and processors need to work collectively together to try to reduce the incidence of. So in summary, liver abscesses are a significant economic loss in the Canadian beef cattle industry. Liver abscesses are secondary to grain overload or ruminal acidosis, either acute or subacute. We encourage producers to work with their nutritionists and veterinarians on ways to reduce the risk of liver abscesses. This includes good or sound nutritional management. We also encourage you to stay attuned to new research. The Beef Cattle Research Council is currently funding some research with Dr. Greg Penner from the University of Saskatchewan, trying to get a better understanding of specific risk factors related to ruminal acidosis and liver abscesses, including environmental factors and individual animal susceptibility. Currently, feedlot producers can use tylosin in the feed to reduce the risk of liver abscesses. However, long-term, due to the concerns of antimicrobial resistance related to the feeding of antimicrobials at low levels for long-term in cattle, we most likely will have to find alternative ways to reduce the risk of liver abscesses. This may include the development of new efficacious vaccines or novel feed additives such as probiotics or prebiotics that can be used to reduce the risk of ruminal acidosis and also liver abscesses.